surgery day. It is. Good morning. Today is December 6th. It's the day that I'll go for my surgery. So hopefully all goes well. Please pray for me. I just washed my face and brushed my teeth, a mouthwash. That's it. I did not even shower because that's what the instruction last night. They said I have to shower using that heavy cleanse that my surgeon prescribed, and I have to wipe using that body wipes that they provide during pre-op, change new clothes, change sheets. So that's what we did in preparation for today. So no food, nothing by mouth after 12 midnight last night, but I actually stopped eating around 5 p.m. So I'm not nervous at all, thank God, though I did not sleep last night. Just thinking about it, I can't erase that in my head. I'm just anxious but not nervous, and but I don't know how I will feel when I'm in the hospital. So I don't know. So yeah, no jewelry, no either. So nothing at all in your body, no lotion either, no deodorant. So I felt like my whole body so dry, nothing in your face. So this is as good as you get. Okay, I'll see you guys in the hospital.
Is this really happening? I can't believe it's true. I'm just as surprised as you. Is this really happening? I can't be too sure, but one day I'll be yours again.
Here we go.
Hospital parking lot.
This is the one.
Insurance, did they go over that you at pre-op?
We are here inside the third floor, just waiting. We already checked in.
Checked in and got our advanced airline miles squared away for our next trip.
So Mike already paid too. Just waiting. I have to change in this gown. Do my wipes, blanket, socks, put my clothes in here. This is my temporary room while waiting for my surgery.
This is my wife before the surgery.
I have my IV. I also have this for blood.
Blood clots?
Not to get blood clot. Like after a surgery, it will squeeze. Now I'm a little nervous, but not as nervous as the other days.
Much later.
You okay? You did really good. The doctor said you did really good. First thing I asked was bikini cut, and he said, yep. So this is right after. So we'll take progress reports every day to see how she's doing.
Later.
Are you talking about this?
What?
The syringe?
Yeah. When they gave you the happy juice, and they attached the syringe to it for your IV, and it was a smaller syringe than mine. The one I had was bigger, obviously, because I'm bigger.
I didn't see that one. Didn't feel anything during surgery for sure. Now it's just sore. Very uncomfortable.
So, what advice would you give somebody to anticipate having this surgery?
The surgery itself is great because you don't feel it. Depending on your doctor and depending on your situation, about how long it will finish. The doctor said it was 2 hours, but my husband said it's less than that, so it was quick. you don't have appetite to eat, you can probably eat a little bit. Not your normal appetite.
Well, they said that you're probably going to get your appetite back for another day or so.
Yeah. But yeah, I have a C-section bikini cut, which I'm glad because bikini cut is like this, then the vertical is like this.
Which you were trying to stay away from.
Yeah. So,
They said the first thing you asked the doctor was, did she give you a bikini?
yeah, he did. I really thought it would be vertical,
Well, you know, so we did it.
but he did.
Good for him.
Hysterectomy at 39 and a half,
Well, about 40.
40 years old, yeah.
So, which is, you know, I would say it's really young for hysterectomy because there are people who have had it in their 20s.
Yeah.
But it depends upon why you have it. With
Yeah.
you, it's just uncomfortable, fibroids, excessive bleeding during your period. Yeah.
Yeah. Bloating.
Bloating too. And you were definitely showing. There's no question about it.
Yeah.
Okay, that's all the updates for now. We'll continue on the dialogue later.
The next day.
Day 2, post-op. Everything is great. My surgery was great. They put me to sleep. I can't even remember when I got to the room. And the last time I remember is when that guy put some, as what he said, a happy juice. And then I was out. And then after that, I think that's the time they roll out the stretcher. So, and then the next thing I knew, I'm in the recovery. So the doctor was saying that it will be 2 hours, but actually it's an hour and a half. He told my husband, so that's good. The nurses were good. They were so kind. They really take care of you, so I'm very happy about that. They just took my catheter because they want me to pee in the bathroom now today, and then we're also gonna walk. So yeah, so far so good. This morning the PCT came in, and patient care assistant came in. She took my blood pressure. It was good, 103/55, I think that was. The doctor, my surgeon, came in, and he checked my belly. He says looking great, and he asking me if I have pain. I said no. So today the goal is able to pass gas and then at least go to the bathroom. So that's it. And he also told me not, because this breakfast, he also told me not to eat at all, just half of what they gave me. So don't eat abruptly. So I'm so thankful that I have a great surgeon. My experience wasn't bad at all. It's actually really great. And then I need to shower. That's what I'm using. And they tape this right here so it won't get wet. He just visited me and now he's...
Yes, I visited her. Make sure she was still alive.
Oh my gosh.
I threw her out of bed and said, "You're walking, damn it. Let's go."
We did walk in the hallway.
Yeah, a little bit.
Because the doctor said I have to walk
Yeah.
just a little bit. But
Now she's got to pee.
yeah, but
Ugh.
yeah.
Battery's getting low. Hopefully she'll be coming home tomorrow, but if not, maybe the next day. Hopefully. Things are progressing, so I'm happy.
Yeah. Okay.
See you later.
See ya. Now, they brought me some food, guys. They really feed you well over here. And I have bread, juice. This one is peach cobbler.
Hallie, the woman's death was due to a cerebral hemorrhage. She was the mother of 7 children. Her We have a patient with localized tuberculosis in its home for the past 3 years.
Okay, so the doctor wants me to walk. I already walk here and in the hallway with my husband. I'm gonna do it again. Let's go. So that's it for my walking. I'll do it again after a couple hours from now. So yeah, I'm glad I can walk, that's for sure. But slowly though. Slowly but surely, guys.
Yeah. So, is it gone now? No.
What is happening, you guys?
Ooh,
What is
Oh,
happening?
it's gone now. It's gone. Now it's gone.
the hardest part is
That was a lot.
sitting down and getting up.
It was like bombarding me. And
This is my view.
turn ideas into I did it.
Hello everyone, so another update. My incision area is tender and sore, but apart from that, no pain, which is I'm very thankful for. And today the goal is to pass gas, walk, and I was able to do that. I even went to the bathroom, do my number 2, and it did not hurt anything. It did not hurt to pee by myself without the catheter, but it took me a while. Yeah, I'm very fortunate because before this surgery, I actually was very worried because I saw a lot of YouTube videos saying that we'll have an excruciating pain after surgery, so and so forth, or for a few days after your post-op, but with me I have none. So I think they managed my pain pretty quickly while I'm in surgery and after, I guess, but I still went very slow. I don't want anything that will happen. I need to be careful, even though I knew I'm feeling good right now. So if any one of you ladies out there who needs a hysterectomy, don't be scared. You will not know anything. It was a very easy one. If it's about your health, you know, definitely do it. And they will give you food, breakfast, lunch, and dinner, and they will give you drinks even though you're not asking for it. Like the nurse assistant gave me 3 apple juice. I have not asked for it, but yeah, I don't keep calling the nurse because I know there's also busy, so I haven't been calling them since day 1. They'll just come in and check how I'm doing. So yeah, my lips are still very dry. I keep putting the ointment for my lips, but it's still, I can feel it's still very dry. And it's because during my surgery, they put like a tubing in. And I guess that makes your lips dry, and even my voice, it's still not 100%. Yeah, I just want to share my journey. Day 2 in the hospital, and this is my dinner. I was just asking for a warm blanket, that's all.
Okay,
Thank you.
you're welcome.
Good morning. Today is my 3rd day. The only pain I have is when I get off from the bed and get back in. That's pretty much it. Last night I was able to sleep more compared to the other night, just because you really cannot sleep straight when you're in the hospital, because nurses and then the patient care assistant, you know, they will keep checking on you, check your blood pressure and all that, give you medicine. And today is my discharge day. I just have to wait for my husband to come here. 11 a.m. is the discharge time. My surgeon came in early today, before 7 o'clock. He checked my incision. He said everything is good. He just told me not to lift anything, keep it light until you really get healed to avoid complications. Very fortunate with this experience. There's nothing bad that I can say. The only thing is I have to have this little pillow when I walk, so I can kind of press that where my incision area is, because I felt like, I don't know, whoever had an experience with this type of surgery, I don't know if you felt like it's gonna fall. That's how I felt like when I get up I have to have a pillow because I felt like if I don't, I felt like something's gonna fall off. It's weird. The only thing is when I cough, I'm about to cough. It hurts. I don't like it.
When I worked in the ER downstairs.
Oh, they are? There's a lot of, before there's a lot of Filipino nurses in the ER, but they transferred in California now.
Oh.
Yeah, so I think it's only 3 of them left.
Wow.
Before it was like almost Filipinos in the ER.
Yeah. When I worked, this was back in 2021 when I worked in the ER here, but there were quite a few of them, and they mainly worked night shift.
Yeah.
And they would,
You were night shift before?
yes.
How do you like it now?
How did I like night shift?
Yeah.
I like the flow.
Yeah.
It's a lot slower. The people that you work with, they're usually nicer and they're more
Than
helpful.
the day shift? Than the day shift?
Well, as far as comparing it to, well, I haven't worked night shift here, but
Yeah.
at other places where I worked night shift, yeah, it was better teamwork and everything.
Yeah.
But yeah, I worked here in the ER.
Yeah.
I worked in Atlanta. I just
Where?
transferred.
Were you from Atlanta?
I'm from here.
Oh, you're
But
from
I
here.
moved
But you
to
work over.
Atlanta.
Oh,
Mhm.
okay.
I moved to Atlanta for
Did
like
you
a
ever
year.
do travel nurse? No.
No, because most of my experiences in mother baby, I only did 6 months in the ER,
Oh.
so I couldn't travel with
Oh, I see.
unless I had more experience in the
Yeah.
ER.
You like doing like this OB?
I do, or I did,
Yeah.
but it's so different here. We get a lot of patients like you, GYN patients,
Yeah.
which I'm not really used to.
Oh.
But I mean, the patients are fine. It's just the different kind of work because, like, when you're fresh out of surgery, you have to spend a lot of time in the room just making sure you're okay and making
Yeah.
sure you're comfortable.
Right.
And then I feel like I neglect the moms and the babies because I'm just trying to make sure my other patients are good. Because the moms and the babies are usually fine.
Yeah.
But yeah, it's just a little more work with a mixture of patients,
Yeah.
shall I say.
What do you think about me?
No, you're fine. But like I last
I'm
night.
about to check out. My husband is here. I have cookies for the nurses over here that we're gonna give it to.
The sheets that we washed.
Oh. I just
I know. I'm just getting them in position.
Let's see if I can do it.
Because you're going to acquire some abs.
And just like that, we are home. Oh my god. It feels like it's gonna drop. Yeah.
And then this is your Christmas card.
Thank you, Mama. Thank you. It's very nice to be home compared to the hospital, even though the room that I stayed at, it's, it's nice and spacious, but nothing beats home.